Welcome. We will now explain the different and most common terms of dementia. Are you caring for someone with dementia? See the online course titled Being a Dementia Caregiver on udemy.com. Let us begin with the word diagnosis, the act of determining the nature and cause of a disease or injury through evaluation of patient history, examination and review of laboratory data. Symptoms, an indication of a disorder or a disease. There are many different types of dementia like Alzheimer's disease, vascular dementia, mixed, dementia, Lewy body and frontal lobe dementia. Depression, a mood disorder that negatively affects how someone is feeling, typically marked by sadness, inactivity and difficulty in thinking and concentration. Many of the symptoms of dementia can also be caused by depression. Endocrine gland, a gland responsible for hormone secretion. Gene, a sequence of DNA that may be further processed to produce a protein with a specific function. Genetic test. A genetic test allows the identification of certain genes that may increase the risk of Alzheimer's disease. Hemoglobin, an iron-containing protein found in the blood. This protein is responsible for carrying oxygen from the lungs to vital organs. Hormones, a chemical produced by living cells that circulated in bodily fluids and produces an often stimulatory effect on the body. In vitro studies, studies which are conducted outside the living organism. In vivo studies which are conducted inside the living organism. Lumbar puncture, a medical procedure that may indicate Alzheimer's disease. A sample of cerebrospinal fluid can be taken from the lower back. The proteins in this fluid can indicate whether a patient has Alzheimer's disease. Mild cognitive impairment, a stage between the expected cognitive decline of aging and the more serious decline of dementia. This can involve, but is not limited to, memory and language problems. Although typically associated with dementia, mild cognitive impairment, MCI, can also be caused by other conditions, such as anxiety and depression. MRI scan. MRI stands for magnetic resonance imaging. This is a non-invasive medical imaging technique used to create an image of the brain which can help confirm a diagnosis of dementia. Neuron, a nerve cell which makes up a part of the nervous system of the brain. Psychiatric evaluation, a way of assessing an individual's behavior to determine whether depression or any other mental health condition may be contributing to an individual's condition. Therapeutic target, the biological target which is affected by a drug. This effect causes the biological response of the drug. Vascular, relating to the blood vessels in the brain. Dementia isn't a specific disease, it's an umbrella term for symptoms like memory loss and confusion that interfere with daily life. These changes go beyond normal aging, affecting thinking, behavior, and mood. Imagine your mind as a filing cabinet. Dementia makes it hard to find the files you need. Remember, dementia is a collection of symptoms, not a normal part of aging.